Good Tuesday afternoon. I'm Dina Mashburn, Director of Nursing for the Knox County Health Department. I will start providing several of these updates as we address the COVID-19 vaccine. Our moment of gratitude is dedicated to everyone who is working diligently to provide COVID vaccines to those in our community. This has been a massive undertaking, all the way from the federal and statewide level to here at the local level. This vaccine signifies a light at the end of what has been a very dark tunnel, but there is still a lot of work to be done. Today, we want to focus on three main topics regarding the vaccine: its safety and effectiveness, the importance of seeking out trusted sources, and our local situation. First, vaccine arriving this week in Tennessee is incredible news and one we do not want to understate. This vaccine represents hope and the best tool to end this pandemic. Receiving the vaccine is a personal decision and completely voluntary. That said, we are incredibly encouraged by the news from the scientific community illustrating the safety and effectiveness of this vaccine and look forward to it limiting the burden of disease in our community. As a reminder, these vaccines we are discussing are a 2-dose series. That means it's not until after your second dose takes effect that you will experience that high level of immunity. It will take months for the vaccine to be widely available in our community, and until then, it is critical that we still follow all of the protective measures in order to keep ourselves and our loved ones safe and healthy. With that in mind, we want to stress to folks in our community that just because vaccine is arriving this week, we must continue to diligently follow the 5 core actions. That means wearing a mask, physical distancing, and staying home if you are sick or told to quarantine. Everyone needs to follow these actions in every situation to protect our community. That leads us into the importance of seeking out trusted sources for your information. We can't underscore this enough. As we've seen throughout the pandemic, the volume of misinformation is astounding and can be overwhelming. Unfortunately, we know this will continue to be the case as the vaccine makes its way into our community. As you make the decision for you and your family regarding whether to get the vaccine, we urge you to seek out verified and trusted sources for your information. Those places include the CDC, World Health Organization, Tennessee Department of Health, KCHD, and your medical provider. As always, but now more than ever, be cautious of what you read on social media and hear through word of mouth. Verify what you are reading and hearing with an accurate source. Now, onto our local situation regarding the vaccine in our community. First, this vaccine's distribution plan is extremely extensive and has many moving parts. It's important to point out that the vaccine will first be given to the priority groups as outlined in the statewide plan. At this point, the process of immunizing these groups is a partnership between hospitals, public health, and pharmacies. Yesterday, the Tennessee Department of Health announced that the state received its first shipment of Pfizer vaccine. Per TDH, these shipments will be received by some hospitals across the state this week. Here at KCHD, we anticipate that we will receive the Moderna vaccine. We expect to have vaccine available to administer shortly after the emergency use authorization is issued by the FDA. We anticipate that this could be sometime as early as next week. We have plans in place and are prepared to begin immunizing our assigned groups shortly after we receive it. Regarding how much vaccine we will get, that number is fluctuating due to the evolving situation. We will provide information regarding dates and vaccine amounts as we physically receive the vaccine. As a reminder, the vaccine will arrive in small batches, trickling in over the upcoming weeks and months. These first batches will be used to vaccinate those who have been identified as the first priority group in the statewide plan. Now, we will pull up a graphic used in the statewide plan that shows the vaccine allocations and phases and the order in which folks can expect to receive the vaccine. As a quick note, you can find this plan in its entirety on either the state's website or our COVID-19 webpage under COVID vaccine information. The first groups to receive this vaccine will be frontline healthcare workers, residents and staff of long-term care facilities, and first responders. Just for some perspective, there are about 450,000 of these individuals across our state that are part of this first priority group, which is titled 1A1. It is not anticipated that the state will receive enough vaccine initially to immunize this entire first priority group in its entirety. Of course, receiving this vaccine is voluntary and is a personal decision for everyone, regardless of which group you fall into. Second graphic, as you can see, even in the first priority group, there are several subsets. Within those groups, folks will be prioritized further, with those who meet high-risk criteria vaccinated first. Every entity across our community who will be administering this vaccine will be following these phases. The big takeaway here is that even with multiple partners vaccinating in our community, it will take months before the vaccine is widely available. For example, if you are a healthy 40-year-old whose employment doesn't place you in one of the first priority groups, you can expect to be in one of the later phases, which means vaccination will likely be available to you in the spring or summer. Please be patient and know this process will take some time. We are moving in the right direction, but in the meantime, it's incredibly important that we remain committed to reducing the impact of COVID-19 presently facing our community. And right now, that impact is heavy, as you will see in our local data report. All of the data continues to be posted on our website, but for brevity's sake, we will be shortening the data points that we include in the briefing. Today, we have 511 new confirmed cases since yesterday's report. There are 4,301 active cases in our county. 122 Knox County residents are currently hospitalized. And sadly, we have 5 additional deaths to report, raising our total to 223. Before I open it up for questions, I want to take a minute to stop and consider that last sentence. For the past several weeks, we have reported deaths more frequently than at any point in the pandemic. It is critical that we remember that these are not data points, they are people. Today, we are reporting 5 more people have died related to COVID-19. That's 5 families that are approaching the holidays without a loved one. In the midst of the debates and the discourse, please do not forget the human toll this virus is taking on our community. I'll now open it up for questions.
All right, thank you. For the members of the media who are on the call, if you'll please submit your questions into the chat feature. Up first, we have Alan from inside of Knoxville. With so many cities across the country getting the vaccine early in the week, why is Knoxville not getting the vaccine until late in the week?
I really can't directly answer that question. That has to do, everybody can't be the first, and it's Tennessee Department of Health in relation to the federal group are the ones planning that out and have set that in action.
All right, I have another question from Alan with inside of Knoxville. Many of us have elderly members of the family who have been kept from contact with the rest of the family for nearly a year because of the pandemic. Once an elderly member of the family is vaccinated, is it safe to welcome them back into family dinners, even if others in the gathering have not been vaccinated?
We are really asking that everybody continue the 5 core actions to protect each other. The vaccine, no vaccine is 100% protective. This is a new vaccine. We're really hopeful that the studies look really good. But for now, everybody needs to consider following the actions until we really know, and until the vaccine's out there and we really start seeing the numbers decreasing.
I think you just answered this one, but Alan's next question with also, again, with inside of Knoxville is after being vaccinated, is it necessary to continue wearing a mask? And I believe you've already answered that. So
Yes.
we'll move on then. So again, Alan with inside of Knoxville, the announcement was made yesterday at the state level that testing hours will be reduced at local health departments. How much impact will this have on total state testing? Is now the time to reduce testing?
Well, we're still coming up with a plan for how we're going to handle all of that, and it definitely concern, but we really need to be focusing now our efforts on vaccinations. That's our role, and I can't speak to how the state is planning to get the testing out there. What we are really focusing on is getting the vaccine moving. And remembering too that we aren't the only place in this community where you can get testing.
All right, and Alan, just to kind of reiterate on that too, our staff that does testing is also many of the same staff who are going to be providing vaccination.
Yes.
Vincent from the News Sentinel has asked, can you clarify how the Knox County Health Department is or is not involved in the statewide vaccine plan?
We're the local entity, one of the local entities partnering on the ground to get the vaccine out there. So that's our primary role. The planning is happening at the Tennessee Department of Health in coordination with the federal authorities, and we're the people on the ground to get it into arms.
Also from Vincent with the News Sentinel, can you comment on the difficulties faced by Knox County as one of the only local health departments that can implement their own pandemic policy, given that surrounding counties are controlled by state health policy?
I really can't speak to I think that's a good question for the Board of Health. I can't speak to that directly, and I would just say that's a good question for them.
From Vincent, also with the News Sentinel, we have, how closely has the Knox County Health Department been working with the East Regional Health Department?
Well, we communicate with them daily. They are, as we've known before, the virus doesn't stop at the borders. So we coordinate regularly with them.
And Vincent has also asked, how is Dr. Buchanan doing? Is she okay?
I understand she's feeling better, doing well, and quarantining or isolating at home as would be recommended.
And Vincent, I think we talked a little bit about how we'll be vaccinating for your last question there in the opening remarks, since I think you put your questions in early, which is great. But if there's something else we can reiterate on, please add that to the chat and we'll be sure to ask it. Megan with WVLT also asked about Dr. Buchanan's recovery, but thank you for that. And we'll keep moving on there. Cole with WBIR. KCHD says it will receive some of the Moderna vaccine once that gets approved. How do you plan to distribute it? And will that vaccine also go on to other dispensing locations across the county?
I think to clarify, the word distributing is not quite the right word. We will be vaccinating. The vaccine that we receive, we will be using to set up sites where we will be actually vaccinating individuals in the 1A1 group to start with.
Vincent has asked if you could also repeat and spell your name just for the record.
Okay. Dina Mashburn, D-E-N-A M-A-S-H-B-U-R-N.
All right, Cole from WBIR. It's 10 days to Christmas. What should people be doing right now if they want to host family or go to family's house for the holiday? Should they even be doing that? We would really encourage people to stay within their household for celebrations for the holidays this year. Get creative using Zoom calls, trying to find a different way this year in order to keep your family safe. Also from Cole with WBIR, office Christmas parties, good idea or not? Are they even allowed under the gathering limit? Again, I would really recommend that people try and have their celebrations within their households. Those people that they're daily exposed to and that they must be exposed to. Jeff from WATE, we've seen the priority list in the state plan. How does that translate to Knox County beyond the hospitals? We know they're first in line to get vaccinated. When will KCHD be able to give vaccinations to people? When you notify people who may qualify, it goes on to list like nursing homes, vulnerable populations, and how does that process work?
We will be directly reaching out to the organizations that we are responsible for vaccinating. I think that answered the question.
And if not, Jeff, feel free to submit a second question there. Megan with WVLT, a recent report showed the state of Tennessee as the highest place in the world for population. Can you confirm whether or not this is the case, and where does Knox County stand in comparison to case growth in other Tennessee counties?
I apologize, I have not seen that report. I can speak to the fact that our numbers are awfully high right now, that the case rates are increasing, and it's really concerning that our hospitalizations and our death rates are increasing as well.
And then Jeff from WATE, the Pfizer vaccine cleared the advisory panel last Thursday and got approval last Friday with an expected local arrival here Thursday. Using the same timeline would put the Moderna here on Christmas Day. Is that correct? Do you have holiday staffing to handle that arrival? And can media see the arrival of the first vaccines?
I'll tell you, we don't know when exactly the vaccine will arrive. We are hoping that if it's coming next week, it's coming before Christmas Day, but we'll work it out. If it needs to happen, it'll happen. Someone will be here.
Right, and Jeff, regarding your question about media availability, once we have more information about what we're receiving and when, we can provide that information directly to members of the media if that's an opportunity. Cole from WBIR, thanks for clarifying on the vaccination distribution. Will the first vaccinations from the Knox County Health Department look similar to the Fight Flu TN event, or will you be bringing vaccine directly to organizations with people in the 1A1 group?
Probably all of the above.
And then he goes on to ask, will those people come to the health department? He's just asking for a little bit of help so they understand a little bit of the logistics that we're planning for.
I am expecting over the next several months for us to have just about every version of getting vaccine into arms that you can have. Just like we've done with testing, our teams are planning multiple different routes to make it accessible to people, from large pods, and there's a word for 2020, 2021, point of dispensing site in the public health world. We will be setting up large pods to small vaccine clinics, to individuals making an appointment and coming in, to us going to small facilities. I think it'll look a lot of different ways over the next several months.
All right, if there's any more questions, if you'll please go ahead and submit those into the chat feature. Jeff with WAT says he's typing, just 1 second. And then Brian Hornback has asked, all the vaccines are injectable vaccines, correct?
Correct.
We're going to give Jeff just another second to type. Oh, and several more just came in.
Okay.
Okay, hang on just 1 second. So Claire from WUOT, why do you think Tennessee is seeing cases rising so much faster than most other states right now?
It's really hard to know. We do hear of a lot of social activities happening, and that's really where we see the spread. Is, I know we're all tired of it, but we've really got to stick to the guidelines because it does help prevent the spread of vaccine. I mean, you can see where my brain is, not vaccine, but the spread of the virus.
Also from Claire with WOT, do you expect turnaround time for testing to get even longer as staff moves to focusing on vaccinating over testing?
I would anticipate that the lines may happen, realizing that we can't do both at the same time. There's limits on the number of people we have to do any of those things. And I really want to encourage people to seek out testing opportunities in other places across the city. There are several locations in the county. If you go to our website, many of them are identified. And that might be the best route to do that.
So for this next question, Cole with WBIR has asked, as you think about logistics or vaccinations, what are the biggest challenges you are facing?
Misinformation is really one of the biggest. We really ask that people check their sources and seek out science, seek out good studies, seek out information from the highly regarded sources that are available. We really want you to look at experts.
I'm sorry.
No, that's fine.
Jeff from WATE, what's your response to County Commission's discussion last night about shifting the health board's power into the health department's hands, specifically Dr. Buchanan's, and make the Board of Health an advisory board? Is that a good idea from KCHD's perspective?
I have to admit that I have been focusing much more on vaccine than I did on the Board of Health meetings last night or the commission last night. What I can say is that we will follow the guidelines based on whatever county commission decides.
Vincent from the News Sentinel, do you know why the vaccine requires 2 doses?
Well, the first one, it's not atypical for vaccines. It's a very common thing for them. The first vaccine primes your system. It tells you who the enemy is. And then the second one is it mounts the army, essentially, sends in the troops to be able to prevent it from giving you an infection.
All right, and another question from Vincent. Can you comment on the way that a multi-dose vaccine might complicate distribution?
Well, you always have to remember there's a second one to be given. So yes, it does complicate it. Thinking through in most cases, we will be looking for a second shipment in order to give the second vaccine. But it's just easier if you know that you're one and done.
From Jeff with WATE, I suspect anti-vaccine and COVID deniers will see the fact that Dr. Buchanan came down with COVID-19 as evidence that the 5 core actions don't work. Can you offer rebuttal to that notion?
I can't speak specifically to her case. I don't even know the details of it, but what I would say is it's widely spread throughout our community. And so being as cautious as you can, as everybody can, in your households, protecting themselves as well. And following the 5 core actions work. Evidence supports them. Masking works. Evidence supports it.
And from Vincent, has the health department discussed a plan for making sure people get their second dose? If so, what is it?
There will be cards given when you receive a vaccine. You'll get a card saying when your next dose would be due. We are also looking at putting in some texting options. The first dose will also be entered into an inventory system, which we call TENIS, the Tennessee Immunization Inventory System. So it'll recognize when there's a second dose due as well. So there's a lot of different things we're talking through and different options we're going to be using to remind people and encourage that second dose be given.
Cole with WBIR, what happens if someone misses their second dose of vaccine? Do they have to start the process over?
From what we are being told at this point, we will not be wasting that first dose, and we will be recommending they get the second dose whenever they do remember it.
We need to mention the second dose has to be the same type as the first dose.
That's a good point. Yes, the vaccine manufacturer, if you're getting Pfizer, then your second dose needs to be Pfizer. If you get Moderna, the second dose needs to be Moderna, and on down the line. We're hoping others will be approved as well. So that's another complication with the logistics of that second dose, but it also will remind people that they need to get the same kind.
All right, if there's, see, looks like we have Jeff again with WATE. Will KCHD need additional security, same for hospitals, to protect supplies of the vaccines and to handle potential crowds of vaccine seekers?
We have talked through, there are plans in the works for security. I think that most folks in our community know that there's a phased process, and if you can help us get that word out, we will be reaching out to people and getting vaccine into arms as fast as we can. Being patient will help us, we are talking through the security needs.
All right, if there's any more questions, if you'll please submit them, we probably have time for just a couple more. All right, seeing none, thank you very much for your time today, and we'll see you on Thursday. Everyone have a safe and happy rest of the day.